A very good afternoon to uh, dear faculty members and students. Indeed, a very happy to invite Professor Saravanan sir to have a talk on performance testing in sports. Having a small introduction about him, sir has done his bachelor's from Chennai and master's from Punjab and PhD from Gujarat. He has been working more than 20 years in the field of physiotherapy with associated administrative and clinical responsibilities. He has also published more than 25 publications in the peer-reviewed and index journals at the national and international level. He has participated in various conferences at the national and international level and has been a reviewer for the WCPT Congress in various years. Adding to his strength, he has been invited as a chair for the various sessions in India as well as the other countries. He has also been awarded the CP Nayak Oration Award at the 57th Annual Conference of Indian Association of Physiotherapists. So thank you, sir, for accepting our invitation and being part of this webinar. Sir is also working as a professor and principal in Sri Bharti College of Optometry and Physiotherapy, Surat. Over to you, sir.
Thank you so much, sir, for those sweet words. So a warm good afternoon to everybody. And it's my pleasure to be here to share a few points on this particular topic. I think the audiences are interns and PGs, if I'm right. So the PGs might be considering that the topic is more basic for them, probably, as it starts with. And for interns, definitely it is going to be new. So shall we start, sir?
Yes, sir.
Okay, fine. So this is performance testing in sports. Before getting into what exactly performance testing is, I think I want to give a few background about a basic idea about what exactly, where does this performance testing come from? So these are the contents, what we're going to see. Has the slide changed, sir? Content slide, right?
Okay. Yes.
So we'll be discussing about outcome measures, specifically the types of outcome measures, not much in detail, and how that is related to a functional activity and functional progression, where exactly the performance testing plays a major role, and what are the different tests which are commonly used, based on the skills required in different sports. We are not going to target about any specific sport. We're just going to have a highlight about the performance-based measures in general. And finally, the criterion for choosing the right protocol or the test which can be used for performance assessment. And that's how we are going to conclude the session. So when we talk about outcomes, before getting into outcome measure, what is an outcome? An outcome is basically a data which can help to understand the answers for basic questions which are conducted most commonly in our daily practice, that is clinical practice, or in research. What is an outcome measure? It is the test, tool, scale, whatever you say, the assessment that are used for measuring either the participant or the patient's condition. It can be related to symptoms, change in symptoms, change in signs. It can be basically the functioning capabilities of the participant over a period of time, and purely based on the intervention what is given. And to be simpler in this particular aspect, what we try to say is, if you're giving a treatment, there should be an improvement in some aspects of the outcome. So which aspects improved? Whether there was any increment in the symptoms or decrease in the symptoms, how you measure, that becomes your outcome measure. For example, it is required. That is not only in sports, but even in any field of physiotherapy practice, it has to be mandatory. So especially in an era of evidence-based practice, where we talk about evidence for any treatment option, outcome measurement is very mandatory. It can be a basic outcome measure based on symptoms, as I said before, or it can be function-oriented, which is more crucial in today's situation. Because these outcome measurements will give you an objective objectivity towards whether the patient is improved or not. And this objectivity can be reflected to the patient so that the patient also can understand that the results what has been obtained is not subjective, like I like the therapist, so there is improvement, or the therapist says that way that there is improvement, so I also accept it. So objectivity measures can be incorporated, and that is through outcome measurement. So it is very commonly used outcome measures, as PGs might be knowing it. Outcome measures are mandatory when it comes to interventional physiotherapy research. So to identify whether a treatment is effective or not, we normally go for outcome measures. Whereas what is the clinical implication of the same? Are we using all these things in our clinical practice? That is the outcome measures. The answer is it is yes, but unfortunately we are not tagging it as outcome measures. Unknowingly we are using it. So as I said before, monitoring the health status of a participant or a patient before the treatment and after the treatment, before an event and after an event. And that is what is basically outcome measurement, outcome measures that are used in physiotherapy. There's a generalized outline about what is outcome measure and how we are using it in physiotherapy in general. There are various categories of outcome measures which are used in clinical practice basically. The broadest categories are these four basically. The first one is self or patient reported, which we all know that like most of the subjective scales what we use that comes under this particular category. The patient reports how they feel about the symptom, how they feel about the treatment. All these come under self or patient reported. Some of the examples can be SF36, that is short form 36, which is used for quality of life. And even WOMAC score, you can say that like that is Western Ontario McMaster's knee osteoarthritis index, which we commonly use in osteoarthritis patients. We give a set of questions to the participants, and they are supposed to write down or mark it what they feel, what they perceive about that particular component. Say, for example, quality of life, whether the condition, the disease, what they are having, how does it affect the quality of life? Say, pain is more severe that I'm not able to get up from bed. Yes or no? Or you can have a Likert scale where you have a point system like a 3-point Likert scale or a 5-point Likert scale, a 7-point scale, where the patient mentions what they feel about the condition. That is self or patient reported outcome measure. Second one is clinician reported outcome measure, which we normally do, where the clinician does some passive activities on the patient, eliciting the signs, and then make a report of that. That is clinician reported. Most common thing is, say, for example, range of motion. You measure the range of motion, and then you note it down. Objectively, what you measure, that comes under clinician reported. The third one is observer reported. That is in special cases where the patient population cannot give a report by themselves. Examples are pediatric population or patients who are unconscious and in the ICU. So probably you get the report from the guardian, the parents, or from any other attendant. That is observer reported. And the final one, the point of interest for us in today's webinar, that is performance-based measures. Out of all these four common types of outcome measures, performance-based measures are more objective in nature. So here we ask the patient to perform some activities, we give them some activities, they perform it, and we grade it based on their performance. Some of the examples might be like the way we use in sports, sit and reach test, which is used for checking the flexibility of the lower limb. So also done for hamstrings flexibility. We ask the person to bend forward, sit with back straight, and then bend forward, and then touch the toes. Based on the quality of the performance, we quantify, and then we give whether the flexibility is good or bad. These are called as performance-based outcome measures. Sir, is the flow okay? The audio is okay?
Yes, sir.
Is there a lag in the audio, or is it okay?
Okay, fine. Fine,
Anybody?
sir.
It's okay?
Yes.
Okay. Now, this is a description of performance-based measures, where the way I explained, you can score the performance based on objective measurement, or you can go for the qualitative assessment as well. We have a few examples which will be following presently. and where we have examples for both the qualitative and the quantitative aspect. And the scores are preset. In some instances, it is time bound. Say, for example, if it is a timed up and go test or an agility test, it is time bound. In some instances, it is distance based. Like, say, for example, balance testing, what we do, that is distance based. YBT test or the star expression balance test. Those are distance based. So depending on that, we can use it. Now, how these outcome measures, especially performance based, are used in sports physiotherapy. The major objective of using objective measures in sports physiotherapy is to identify the athlete's ability, because we know that like sports requires a lot of high velocity activities, and it is not as static as what we normally a non-athletic population does. It is highly dynamic. So specific to the dynamicity of the sports, we are supposed to identify the athlete's ability. It is in terms of prevention of injury. Say, for example, depending on the sports dynamicity, will they be able to continue with the sports without damaging themselves? That is one thing. In case if there is an injury, will these outcome measures able to identify the re-injury, that is like the participation into sports again, and prevention of getting re-injured? In both these aspects, which means rehabilitation and prehabilitation, outcome measures are very essential in sports physiotherapy. And last point is functional progression, where when we want to rehabilitate a person, we normally a non-athletic population, we rehabilitate them, getting back them to the normal life. Whereas in athletic population, they are supposed to get back to that dynamic sports, the high velocity activities they are supposed to perform. So considering that, we have a specific term called as functional progression, which is highly critical for the athlete to get back into activity. Now, these are the components of functional progression. When we target a functional progression, like say, for example, rehabilitation, we start with identifying the functional movement and targeting that to achieve it. And then that functional movement which has been achieved is supposed to be converted into functional performance. And that functional performance, which is mostly like, related to activities of daily living, that has to be converted into functional skills. As I said, like they are supposed to get back to the highly dynamic environment. So these are the stages of progression of functionality in a sports person. Depending on that, we go for the functional performance testing, which is again called as functional or performance outcome measures. Now, these are essential because like using these tests, we are going to evaluate performance in addition to the skills. And to be precise, it's not only performance, it is functional performance. So that is the main objective of using any performance based outcome measure, to identify the functional performance in relation to the skills. So what does a functional performance test measure? It starts from the basics of the anatomy and the biomechanical components to the complexity of the movement and the dynamicity of the game. So it can be measuring the joint laxity or mobility. It can be measuring the range of motion, the strength or power or endurance. It can be neuromuscular control. I think somebody is raising the hand. Is there a question? Anybody?
No, sir.
I couldn't check that. Somebody raised the hand. Okay, should I continue?
Yes.
Right. So starting from the basics of range of motion, muscle power, it can go on to check the complexity of the human motion, that is neuromuscular control. It can identify dynamic balance or coordination equilibrium. In sports, specific skills like agility can be tested. It can check for the, reaction time, and including some psychological measures can be tested based on performance, that is called as athlete's confidence, or anxiety can be tested. So a lot of components which are physiological, anatomical, biomechanical, and psychological can be tested using various functional performance testing measures. So as I said, like presently we have a change in the concept of understanding anatomy. It is the kinetic chain link, what we say. Even those can be tested. I have not touched that component over here, the testing of the kinetic linkage of the human body in sports. We're not going to see that, but still, that is another component which can be tested using this. So as discussed before, the primary objective, again, I would like to highlight, is to identify the patient's or the athlete's ability to participate in sports, getting themselves out of injury, or in case if there is an injury, getting back to sports and not getting re-injured again. That is the main purpose of any functional performance testing measure. First one, the basic one, which can be discussed upon, is the functional movement screen. This is applicable to even non-athletic population because these are some of the commonest methods which is used. But still, in sports population, the 7 components that are used in this FMS, that is more crucial because it covers almost all the components of the body, all the parts of the body. So upper limb, lower limb, trunk, and coordination, everything is targeted in this. So it is a very simple and quantifiable method. And these are the 7 components that are tested using functional movement screen. The first one is squatting. We call this as inline squatting. And the second one is stepping on a hurdle. Third one is inline lunges. The fourth one is called as shoulder stability, which is through reaching. And the fifth one is simple leg raising, trying to identify the pelvic stability of the individual as well. The seventh one is push-ups. That is again rotatory stability push-up. And the last one is no push-ups, only rotatory stability. So all these 7 components are tested in the athlete, one by one, with appropriate rest period in between. And this does not require much of a tool or equipment which is very costly or which is unavailable. These are simple tests which can be done. And this is a scoring for the FMS. So based on the performance of the movement, the quality of the movement is assessed along with quantification of the same using these scores or grades. So you give the highest score, that is 3, and the athlete is able to complete the task and there is no compensation as per the established criteria. The second one is there is poor mechanics, but still the athlete is able to complete the pattern of movement with a lot of compensations. The third one is even with compensations, if the athlete is not able to complete the task, like that is graded as 1. And any pain reported by the athlete during any of this performance, that becomes 0. So based on this, you can quantify the quality of the movements which are used in FMS. Now this is the basic procedure you can say. Now this very commonly, I think interns I'm not sure about. Again, PGs might be knowing about this. It's one of the oldest tests being used for dynamic balance. It's called a star expression balance test. Now this is the picture where you have 8 directions, and the person stands in the center of the star, and the weight bearing legs balance is being tested, and the opposite leg is moved in all these directions. And there are a set of objective criteria for this. The athlete should be placing the hands on the hips and should be dragging the heel. Basically, this is the star in Indian setup. What we do is we make a star using tapes and we ask the participant to move on this. We have a sliding board for this purpose. So where the measurement, that is in centimeters or in inches, can be measured, and the athlete is supposed to slide on towards the board. So it is considered as the test is supposed to stop when the heel comes off the floor or the athlete loses balance and tries to compensate. That's where the distance is stopped. And what is measured over here is the distance moved by the non-weight bearing limb in centimeters or in inches. That is what is being measured. And this distance is calculated for all the 8 directions, and a composite score of the left and right side separately, along with the normalization of the limb length. You measure the limb length of the participant, and then you have a formula where you substitute that and you get a composite score. Longer the distance, good the dynamic balances. That is what is the interpretation of this particular test. The disadvantage of this testing is basically the athlete is supposed to perform the test in 8 directions for both sides, which means 16 times he will be performing the test. So a few studies have been done to consider whether any test can possibly take over this test in terms of time consumption and the complexity. And that is when the Y-balance test came into existence. So this test, in comparison to the SCBT, has got only 3 directions. 8 plus 8, 16 directions. There you have 3 plus 3, 6 directions. So it consumes less time as compared to the SCBT. And the validity of this test is as equal to SCBT. So this is replaced. This has replaced SCBT now. And it has got a good reliability as well. Now, this is the Y balance test, and this is the tool what I said, the slider. So you have only three directions in this: the anterior reach, posteromedial reach, and the posterolateral reach. Now, again, for bilateral limbs, you check it, and the composite score gives an idea about the dynamic balance of the athlete, left side and the right side. Now, this same tool can be used for measuring the upper limb closed kinetic chain stability as well. So it's called as closed kinetic chain upper extremity stability test, where you go into a push-up position, and then you try to reach using your non-stable hand. And in this example, the athlete is performing stability testing for the right side. She is moving the left arm in the directions. Again, the distance covered by the left arm is measured, and the composite score gives an idea about the stability of the right shoulder of this athlete. So this is using a single tool. You can perform this test for the upper limb as well as for the lower limb. So this is again a performance-based measure. And then we have the commonly used hop test. And these tests are very commonly used. You have a lot of variations in this. You can have simple hop test, single leg hop test, both leg hop test, side hop test, which we call as lateral hop test, and then hurdle hop test. A lot of variations. What you're saying is hurdle hop test over here. This is a very good method to assess the lower extremity explosive power. At the same time, it assesses the dynamic balance along with explosive power. And these are the examples what you can see, like again, different examples. On the right to the screen, what you're seeing is lateral hop test, which is done unilaterally. And this one is again hurdle hop test. And then we have agility test. Agility is ability of a person, of an athlete, to change the direction without reducing the speed. Which is very commonly seen in most of the sports. Like for example, football, hockey, it is commonly seen in rugby as well, even basketball. Like the speed of the athlete is supposed to be maintained, but the direction is not linear. They have to move in any direction. So that there might be sudden change in direction. And if the athlete loses the speed in that course, ultimately the performance will be reduced. So ability of an athlete to maintain the speed with changing in direction, that is what is called as agility. So a lot of tests again for agility. One of the commonly used tests is called as Illinois agility test. The image what you're seeing here, say for example, you have a starting point and then a finishing point. You have cones placed in this, and the athlete starts with lying prone on the ground at the starting point, and at the count of 3 or at the point of signal, he's supposed to run in the direction mentioned over here. He runs linearly and then takes a U-turn, comes back again, and then goes in zigzag pattern, again comes back, and then finishes the line. Now this, the time taken to cover this particular distance throughout, from the starting point till the finishing line, that is what is measured over here. So lesser the time, more the agility. That is the output of this. The other common agility test that is used is called as T test. So it's called as T test because it is in the shape of a T. You run for, there are cones placed at 10 meters distance. That is in a linear line. They run forward and then they run laterally towards the left side, 5 meters, touch the cone. Right side, again 5 meters, touch the cone, come to the center and run backwards 10 meters to the starting point. Again here, the time taken to cover this particular distance is what is measured, and that gives an idea about the agility component. And agility can be tested using some reactive, we call this as photocells. The picture what you see over here is the cursor moving.
Yes, sir.
On the image. I'm not able to see the cursor moving on the image. Is it moving on the image?
Yes, sir. Yes, it is moving.
Okay. D1, D2, if you're able to identify D1, D2, they are photocells basically. And the athlete starts from the starting point, that is A. He runs straight for 5 meters, and then there will be blinkers. What is the reactive sectors like? They blink, and from there, whichever area is blinking, say for example, it can be random. Either the right side might blink or the left side might blink. Depending on that, the athlete is supposed to reach there. And once they cross that particular photo cell, the light will go off. And the time when they reach over there, that is measured automatically. Now, again, here the time taken, reaction time, where they reach that particular reactor and then switch off the signal. That time is calculated over here. Again, this is very commonly used in football. FIFA normally uses this sort of multiple photo cells to identify the agility level of the participants, including the reaction time. So it is not only the speed with change of direction that is being assessed over here, even the reaction, eye, leg, and coordination, what you can say. They have to identify which photo cell is giving the signal. They are supposed to cross that faster. They're supposed to cross it to cut off the signal. So even that is being tested in this. And then we have the explosive power test, which is commonly used in physiotherapy. That is called as vertical jump test. Here we are using, the picture shows, it is a simple vertical jump test where you measure the standing height, that is picture 1. And then the athlete goes for a squat position, that is picture 2. And then he jumps high as much as possible, and that is marked. The difference between the standing height and the jumped height, that is what is the centimeters or in inches. That is what is the jump height of the particular participant. Now, this again can be used using tools. In sports, normally where we don't have a tool, we use this wall method. But you have a tool, this is called as vanes. Athlete jumps over there and then he touches the vane leg. So the you can see the picture on the right side where different colors and the height measurements are mentioned over there. So it is rotatable actually. When you push it, like, it rotates to the opposite side. The athlete jumps and pushes the vane to the opposite side. Ultimately, the number of vanes, maximum one, can be identified using that, and that height is considered as the vertical jump height of the athlete. And this is available in most of the sports institutes where vertical jump height is used very commonly. And this one is again for cardiovascular endurance. Mostly participants might be very familiar with this test, at least the name of the test, which was formulated using this basic test. So this is called as 20-meter multi-stage shuttle run, also called as beep test, also called as PACER, progressive aerobic cardiac endurance tester. So now when you talk about this, you have a 20 meters distance where the cones are placed, and you have a metronome, which is recorded. Multi-stage fitness test recording is already available. So the speed starts with a very slow speed. So based on the metronome, the athlete starts jogging initially from point A to point B. They are supposed to reach point B before the beep ends. Second beep starts, again the athlete starts from point B to point A back. This way they keep shuttling, and after every few minutes or few seconds, the metronome beep starts increasing in speed. The number of laps the athlete can cover, that is what is counted over here. And before the end of the beep, if the athlete fails to reach the either of the cone consecutively 2 times, the test is terminated. So this again is an indirect measure for calculating VO2 max based on the cardiovascular endurance that is covered in 20 meters. And this test was modified, and then recently it is being used as the yo-yo test. Most of you might be familiar with that, which was very commonly used in cricket players recently. I think when I say recent, it is almost 5 to 7 years back. I think only 2 cricket players cleared it. Others were not able to clear it. So that yo-yo test is purely based on the principles of this beep test. So based on the demands, like every sport has got a individual profile. So what that sport demands, based on that, you have to choose the performance testing. So say, for example, if you have a profile of demands in endurance sports, now if you use any test, out of a score of 5, if you say, the test normally measures the technique, the grading is 3. So you can see this, based on this grading out of 5, endurance test should be targeting the aerobic demands maximally. At the same time, anaerobic demands are also supposed to be considered, whereas speed is given the least number. Right? The output of the testing should be targeting these demands. Now, apart from this basic testing, can we have the participants' mic unmuted, sir? If somebody wants to answer these things, what exactly it is, they might be knowing the answers for this. Is it possible?
It is unmuted, I think.
Hello. Is it possible for the participants to participate?
Meet. Sir, isokinetic device.
Sir, am I audible?
Yes, yes. Right now you're audible. Yes, sir. Proceed, sir.
I'm not able to hear anybody, sir. Am I audible?
Yes, sir, you're audible.
Somebody said isokinetic.
You're audible.
Yes, sir, you're audible.
See, you're audible.
So what does it measure? Power, endurance, and sometimes range of motion. Okay, power, endurance is fine. Does not measure range of motion as such. That's fine. So what about this? What is this equipment and what is that one?
Cable tensionometer.
Sir, I think Jayaprakash sir is saying something. I'm not able to hear, but I'm sorry.
Sir, I'm interacting with this.
I think participants can type the answer in the Q&A box. Q&A. Chat one. Yeah. So you can continue.
Okay, I mean, can anybody drop this in the message? What do you think of this equipment and what does it measure?
वासास्विक एगोमीटर ऐसे बोल रहा है.
Okay, this one is arm crank ergometer, which is used to check the strength, endurance, skill of upper limb. And the example what is given here with the athlete, it is for swimmers. So if you see, the reason for keeping these images are that like there are equipments which are available, which can be used sports specific to identify whether the specific skills related to the sports can be evaluated or not. So when you talk about performance testing, specific to swimmers, not the individual components of strength or endurance, but the functional component of overall how the strength and endurance can be converted into a sports skill that is being tested using this arm crank ergometer. And these are the photo cells which I was talking about, which can be used in agility, where you can identify how fast an athlete can change the direction and reach the point to, reaction time, to improve their reaction time and how alert they are. So if you can understand that in terms of the sport, say for example, basketball or football, your teammate is going to pass the ball to you. Like you never know when is that going to be passed. So when you run in a specific direction and you're able to identify that the ball is going to be passed to you, the reaction time plays a crucial role in that. So based on that, like you have, I mean, initially, previously we used to have individuals taking the role of these signals and then commanding, like moving to right, moving to left, that sort of. And technology has helped us by giving these photo cells, which has got specific sensors, which can identify the person passing through that and calculate the time and give it to you. Now, these sensors are available very easily nowadays, even in India, which can be used for quantitatively or objectively measuring these things. So I'll just show you a few videos of some of this for easy understanding. Is the screen visible, sir?
No, sir.
Is the video screen showing?
No. Yes, sir. Yes, no.
Are you able to see the screen, video screen?
Yes, yes.
Okay. Now what you see here, these are the small sensors which are being set up here for
अभी मैं वाइड पर स्टूडेंट ने भी देख लिया सब स्टूडेंट सब देख लिया
as you can see, these are the portable sensors which has replaced the photo cells now. Photo cells, I mean, are basically huge and it has to be wired. Now these are replaced by these wireless portable photo cells, which has got a magnet which can be attached to any surface, even on the ground. So these sensors basically work on the principle that when a person moves towards it, like the light changes, and that is the end component. The beginning component is that like it gives random signals. Like I can show you that in this. So if you observe that video, the moment she waved, the physiotherapist waved her hands over the sensor, the lights go off. So you get a signal randomly from any of these sensors placed in any direction. And the moment you cross that, the signal goes off, the light goes off. So you have to reach the point before, till the light goes off. That is the time duration which is being calculated in this. So this is one of the advancement of technology in performance testing. Apart from that, we have trunk isokinetic equipments also can be used for this purpose. And one of the agility tests which is used in the laboratory, other than the ones what we discussed, that is this four square testing.
Sir, you can share the screen.
Is the video visible, sir?
Screen is not seen.
Is the video showing? No.
Yes, sir.
Now. So all these are the sensors basically. So these are all the white ones, white squares, what you're seeing are the sensors, and the athlete is able to see the big screen. So it is preset basically, and then all the four squares. Now the athlete will be getting signals from the screen. So you can see all the sensors are activated over here after calibration. Now, whichever sensor blinks, there's a signal that is provided through the big screen. The athlete is supposed to run and touch that particular sensor. So that the numbers which are going to blink is completely random. Now the test is started. Starting position. So this is again a different method using the different, I mean, it can be called as the flow sensors to check the agility of the athlete. And all these numbers are random, so athlete won't be knowing where the next number is going to come. So these random numbers again check the reaction time of the athlete along with the speed, change in direction, and everything. So technology is presently is playing a very major role in identifying all these things. We have got a lot of again other options available for this. One of the best method that is presently used is the sensors, where even a simple push-up can be identified whether the angle of push-up is appropriate or not. So you have sensors which is placed between the shoulders, and then you take up the push-up position, you drop down. If your push-up angle, say for example 20 degrees, still up to 20 centimeters, I want the athlete to go down for a push-up position. So these sensors will capture whether the athlete has come down to 20 centimeters or below. If it is above 20 centimeters, the sensor will be showing red light. And similarly, these are connected to the softwares where it will tell you how many number of push-ups you have done in a minute and how many push-ups were as per the norms of 20 centimeters and how many are less than that particular one. So everything can be quantified, starting from the simplest push-up, as I said, to the complex of these things, isokinetics and agility and everything. And these are some of the examples of what we can say performance testing measures. Since we have a lot of options in our tool, in our kit, which one we are supposed to use, how to decide which outcome measure we are supposed to use, performance based in sports. And you can have one outcome measure which can measure everything. So these are the questions which one is supposed to ask either the team of sports specialists, or to self before deciding which outcome measure to use. The first one is appropriateness. Obviously, the tool should be able to appropriately measure what it wants to measure. Second is acceptability, because in sports there are definitely certain restrictions which are which might come in way. So the athletes or the participants should be able to accept it, and that is secondly. Third is feasibility. As I said, the sensors, that is one of the most highly objective measures which can be used, but will that be possible for us to, I mean, have it in our setup? So feasibility of the equipment and the usage, that is also another point. Whether the results which are obtained through these outcome measures, whether it is interpretable, are we able to identify the results, what it says? And then reliability, validity of the equipment definitely is supposed to be identified. Most of these equipments, what we get for performance-based measures nowadays are, I mean, standard equipments. So that is not an issue. Even the test what we are using, which is not based on technology or equipment, even a field-based testing, that should be identified for feasibility and reliability. And then what about the responsiveness? What changes we want to detect? Say, for example, a single leg hop test has got a MDC of a few centimeters, say, for example, whether that is applicable to our patient population or the athlete population, and whether that is identifying the prevention of injury or not, the factor which we want to identify, that responsiveness is supposed to be identified again. And then floor and ceiling effect. So what are the worst and best scores, the minimum to maximum score? That needs to be identified. That should be questioned whether the tool what you're using that is able to give you the minimum and maximum flooring and ceiling effect or not. And internal consistency, again, that is a part of your validity. And finally, the sample characteristics. The test what we're using, can it be applicable to almost all the population generalizably, or is it specific to any specific sports or something like that? Even that needs to be understood. If most of these questions, what you ask yourself, gives a positive response for a specific performance test measure, that is the right test measure for your testing. And that's how we use our performance measures. We have not covered all the things as such because it is not possible to cover almost each and everything as I mentioned before. Still, if you have any questions, we can have a discussion fruitfully. Sir, should I log out and come back again, because still I'm not able to hear? Should I try that?
Any questions from the audience? Sir,
Yeah.
there's a question from one of the person. What is the age-related reliability and validity of FMS in sports?
What is the?
Age-related reliability and validity of FMS in sports.
In sports, it does not have much of reliability and validity because it tries to identify the general fitness components. That is the major 5 components, which is flexibility, cardiovascular endurance, muscular endurance, muscle strength. That is what it measures. It does not measure a pure skill-based thing. So it is not highly reliable and valid in any of the sports most commonly. But still, it is considered one of the basic measure for functional movement. So that is commonly used in athletic population as well as non-athletic population.
Okay. Any other questions? Sir, we have Manoj sir with us.
Sir, good evening. Oh, my pleasure, sir. Manoj sir, good afternoon. Hello.
Manoj sir.
Hello.
Sir, good afternoon, sir.
Good afternoon, dear. Thank you very much.
Sir, my pleasure, sir.
I was there in the complete class. I really enjoyed it thoroughly.
I
And thank
missed
you
you,
very
sir.
much.
I didn't see that
Yeah.
because I was busy, sir. Thank you
I,
so much,
I, wa-
sir.
I, wa- it is good to be busy for a teacher.
That is true,
And
sir. That is true.
I was behind the screen as a principal.
Thank you so much for the opportunity, sir. It is always a
No,
pleasure
no.
discussing with students.
In fact, it was our pleasure. Thank you very much. So you
Thank you, sir.
readily accepted our invitation.
Anytime,
And
sir. Anytime.
we are very thankful.
Thank you so much, sir.
And then we meet sometime personally.
Definitely, sir. Waiting for the opportunity to meet.
Sure.
Sure, sir.
Thank you.
Thank you, sir. Any questions from the participants? We got another 10 more minutes. Sir,
There might be 2 reasons why there are no questions. One, they understood everything, which is positive for the presenter, or they understood nothing.
no, they would have understood everything. We will reinforce it.
Let's go positive.
Fine, sir. So I just got one question, sir.
Yes, sir.
Like you said, we have got various tests which are getting performed for the sports athletes, right? So how do you select the test for which sports, which test is to be used? Like we can use this test for everybody, every test, or we have to choose according to the games and then the sporting activities. How to choose a test?
Sports specific.
Say for example, we can take any, say for example, tennis. So there is no point in using a agility test like Illinois agility test, or you can say the reactive test for tennis players, because the game does not involve that much of change in direction and running. It is limited. It is there but limited. And secondly, the game is not only based on lower limb activity as in case of football, whereas it is upper limb activity over here. So the skill performance is dependent on lower limb, but mostly it is on the upper limb. So there I'd be using a performance-based measure like medicine ball throw testing, either depending on the weight for power or depending on the distance for endurance or repetitions for endurance. I'll be using a test which is more specific to tennis. So as a sports physiotherapist, we are supposed to understand the dynamics of the sport, understand which component is required specifically, and we can choose the test accordingly. And as I said, like what we have seen today is hardly the glimpse of test. We have a book called as 101 evaluation test in sports. And that is, there are total 101 tests for all the, I mean, say speed, agility, power, and everything. And that is again tip of the iceberg. We've got huge number of tests which are available. So the thing is, we have to choose the right one based on the dynamics of the sport. Like yo-yo test is used in cricket because I don't know why they brought that to cricket, because cricket does not involve much of endurance. It is not a pure endurance game as compared to any other endurance game. But still, they introduced that in cricket, and it was there for a very short period of time, and it was removed from cricket because of this particular reason. It does not match with the dynamics of the sport.
Okay. Can you suggest any centers in India which are working on the sports performance? Any centers or any institutes?
Yes, sir. Established centers like Patiala, NS Patiala, National Institute of Sports Patiala, and Sai centers, which are existing for more than 15-20 years. Because we have a lot of Sai centers nowadays, which are developing, still developing. I'm not talking about those centers, which are established for the past 10-15 years. They're having all this sports performance labs and departments. And one very nice place recently where I had sent my students for posting is Tamil Nadu Physical Education and Sports University, that is in Chennai, where they are having a very good setup for all this. You have a 3D motion analyzer system, force platform, you have isokinetic dynamometers, you have almost all the setup which is required for a sports over there, like sports specific. That is again a very good center. And New Delhi, we have a few centers which is very good in that. Like the options are more now, sir, as compared to the previous 10-15 years. Now it is too good.
Okay. Fine. Thank you, sir. As the any other questions from the audience is not there, so I'd like to thank you, sir, for the valuable time.
Thank you so much, sir. My heartfelt thanks to Manoj sir, to Bala sir, and to the entire audience who are sitting and listening to me. Definitely you can catch up with me if you have any queries. In case if you are coming up with some new testing procedures, do let me know. Even I would like to upgrade myself in that. We shall keep learning. Thank you so much, sir.
Thank you, sir.
Thank
It
you,
was a
sir.
wonderful session.
Thank you, sir. Thank you for being there.
So we are here with our class completely.
Oh, that's great, sir. That's great. That's great. My pleasure to address such a wonderful audience. But again, I'm not sure whether the audio was clear or not.
It
And
was clear.
secondly, like, okay. And secondly, like the audience, as I said, like 100% they understood everything or they did not understand anything. At least if this session has created some interest, some questions inside their minds, I'm happy.
We enjoyed thoroughly. We enjoyed, sir. Thank you so much.
Thank you. Thank you so much, sir.
Thank you, sir, once again.
Thank
And
you, sir. Thank you.
thanks to Manoj, sir, Principal Sri B.J. Patel College of Physiotherapy, for giving me this opportunity to host the speaker. Thank you, sir. Thank you once again. Thanks to all the participants.